This is the continuation of the NUR 111 concept of safety. We're now going to focus on the adult client and their environmental safety. To begin with this adult client, the proper ID band has been placed on the bed rail instead of on the client's arm. This client also has oxygen on, however it is on his face and not going into the proper location. Infection control purposes, the suction catheter has just been left lying in the bed with a dirty glove. He also has a restraint tied, however one side of the restraint has not been tied at all. The other side is in the proper slip knot, however it is tied to a bed rail. This is also a good teaching point for students to remind them about proper documentation of restraints and following their facility's policy and procedure. The IV tubing is draped across the patient and is wrapped around the bed rail as well. Also, the IV pump is not turned on. Another safety concern for this patient is the footwear is inappropriate. Also note the NPO sign at the end of the patient's bed. When we come to the bedside table, the patient has a drink and an open cup, therefore not following the NPO restrictions. Other things on the bedside table, possible medication that has been left out, a syringe, medication in a cup that is not labeled properly. Is it medication? Home medications left out, the patient could be self-medicating. Another infection control issue, the dentures just left out on the table. Notice the patient's bed is in the upright position and both of the rails on this side are down, as well as the bed not being locked into position. This patient also recently had their IV started and the tourniquet was left in place. Also some IV supplies left lying around. The Foley catheter that the patient has in is not properly secured to his leg. It's also, the bag is touching the floor. Another assessment piece for the students to also notice, the color of the urine is abnormal. This patient is also in bed on a bedpan, increasing the risk for bed sores. The leg falling off of the bed. The clutter in the room with the chair. The incentive spirometer and the patient's cowbell are well out of his reach. Also, the sharps container is full and somewhat overflowing, increasing the risk for a needle stick. Again, these are just some ideas, some possibilities to get you started to set up an activity similar to this, to have the students come in, assess the environment and the situation for the patient, and see what they pick up upon, if they notice what's normal, what's abnormal. Please refer to further in the PowerPoint for an additional developmental safety module. Thank you.